Chapter 2. Health, our greatest asset. I truly believe we're at a crossroads when it comes to our health. Hopefully the pandemic provided an awareness that we all need to take care of our health because it's our greatest asset we own. There have been many incredible advances in health, fitness, and wellness over the last decade. But are we getting healthier as a society? Some of our latest advances or trends include wearable devices, CBD, intermittent fasting, paleo, keto, collagen protein, CrossFit, Peloton, the Mirror, outdoor fitness, digital fitness, remote personal training, mindfulness, meditation, telehealth, and telemedicine, to name just a few. Will some of these new advances become trends that will help us move our society in a healthier direction, or will many become fads that will quickly disappear? Where has our health gone? Even with greater advances in medicine, improved technology, more highly trained health professionals, more medications to choose from, wearables that track our stress, breath, sleep, movement, and just about anything that has to do with our health of the mind and the body, Americans are doing a poor job when it comes to managing their health. Obesity's never been higher. Type 2 diabetes has exploded around the world. Digestive health, cancer, heart disease, mental health, and the list of our health challenges continues to grow. The quality of health in the United States and around the globe is moving in the wrong direction. The United States spends more on health care, or as many refer to it as sick care, than any other developed nation around the world. Healthcare costs in the United States gobble up over 17.5% of our GDP to a tune of over $3.5 trillion each year. This equates to over $10,000 per person spent on healthcare. Most other countries spend a much lower percentage of their GDP on healthcare, coming in at under 9%. Switzerland comes in second to the United States at 12%. If the United States spends the most on healthcare, does that mean that we have the best health? The answer is no. The United States does not even rank in the top 25 of the healthiest countries in the world. Here's a glimpse at per capita spending on healthcare around the world. Keep in mind these costs continue to rise with no end in sight. Healthcare costs per capita. United States, $10,000. Switzerland, $8,000. Norway, $6,300. Germany, $5,700. Ireland, $5,500. France, $4,900. Canada, $4,800. And Australia, $2,500. Think about this for a minute. United States at $10,000, Australia at $2,500. The sad state of health in the United States. In 1960, 1 in 4,000 people in the United States were diagnosed with type 2 diabetes. Today, that number is 1 in 10, trending to 1 in 4. 1 of every 3 Medicare dollars spent in the United States is spent on type 2 diabetes. The United States and New Zealand are the only countries in the world that allow direct-to-consumer drug ads. Over 50% of the United States population over the age of 65 is on 5 prescription medications. Since 1995, the use of antidepressant medications for teens and adults in the United States has risen over 500%. Chronic illnesses account for 85% of all money spent in healthcare in the United States, and around the world, more than $60 billion are spent each year on cholesterol-lowering medications. More than 35% of the women over 50 have thyroid problems or poor bone health. In 1970, less than 10% of the United States population was considered obese. Today, nearly 3 out of 4 adults are overweight or obese. And lastly, 72% of our young people between the ages of 17 and 24 do not qualify for military service because of exceptionally high levels of obesity and poor fitness levels. The list of everyday problems for many adults continues to grow, including high blood pressure, hormonal imbalances, thyroid issues, atrial fibrillation, type 2 diabetes, obesity, sleep problems, high stress, acid reflux, gout, digestive health issues, allergies, asthma, and arthritis, among others. Medicated free in her 80s. A few years ago, my mother, 81 years old at the time, suffered a medical emergency. At the hospital, they asked Mom what medication she was taking. She replied that she did not take any medications. Then they looked at me in confirmation, thinking her memory was failing. I confirmed the fact that my mother knew exactly what she was talking about. They were very surprised and said they rarely see anyone in their 80s who does not take multiple medications. Treat the source, not the symptom. Unfortunately, most of our healthcare professionals are compensated to fix the symptom, not the source of the problem. In many cases, our healthcare professionals are incentivized to prescribe a medication or recommend surgery rather than going after the source of the problem. Why is your blood pressure too high? Why are you having trouble sleeping? Why do you have acid reflux or gout? Why is your knee bothering you? There needs to be a large paradigm shift in the practice of care and how our healthcare professionals get paid for the services they provide. Bring a new perspective to healthcare. Imagine if everybody looked at healthcare from a new perspective. Imagine viewing healthcare as a security blanket. It is there if we need it, but we rarely use it. It is time to take back control of our health. Our goal should be having more healthy people, not more healthcare options. There are multiple reasons why we're moving in the wrong direction when it comes to our health. High levels of stress, lack of sleep, lack of movement, easy access to processed foods and beverages, and poor access to health care are just a few of the problems we face that prevent us from living a life in good health. Looking deeper into our healthcare system in the United States, I think most would agree that we have an incredible trauma care system in place. We are great at putting out fires. If we break a leg or get in a car accident, our healthcare system is the best. Unfortunately, most of the resources in our healthcare system are set up to fix people when they are broken. There's little focus on prevention and the quality of a person's health. We have become fixated on the cure and preoccupied with the disease rather than prevention. Our latest cancer research efforts are focused on developing medications that strengthen our immune system. Imagine if we took a different approach and began educating people on how the immune system works along with simple strategies to rejuvenate it. During COVID-19 pandemic, most of our efforts were focused on wearing a mask, washing our hands, social distancing, and most importantly, the vaccine. All were necessary components for slowing down the pandemic. Unfortunately, not much information was given on how to play offense with our health. Little was said about stress and how it can weaken our immune system and compromise our health. Little was said about promoting strategies on how to balance our nervous system, how to breathe to calm the mind and relax the body, how to get enough sleep and stay hydrated, how to improve gut health, and the importance of moving the body. These are all things that help the mind and the body feel and be their best. The way we currently train most of our healthcare professionals is predicated on a model that the human body heals in isolation. The future psychiatrist needs training in gut health and how the microbiome in the gut affects mental health. The primary care physician needs more training in nutrition to help patients prevent or reverse type 2 diabetes. The physical therapist needs to have a better understanding of stress and how rest can impact the recovery process. This is going to take time, but when we start looking at the bigger picture of health and work together, we can achieve greater health. A person or a protocol. Going into my annual physical years ago, I had an interesting experience. After taking my vitals and measuring my height and weight, the nurse reviewed my results and informed me that my body mass index of 26 classified me as borderline obese. Next, she said my low resting heart rate of 47, which is bradycardic, under 60 beats per minute, and she was concerned that was extremely low. Finally, she stated that my resting blood pressure of 106/70 was too low and wanted to know if I was lightheaded on a regular basis. The point is that she was only looking at the numbers and not looking at the patient. The nurse never asked me anything about my lifestyle. Here is a few things she could have asked. Do you have a lot of stress in your life? Are you a chest or diaphragmatic breather? How much sleep do you get on a regular basis, and is it restful? What type of downtime activities do you practice? How much exercise do you get on a regular basis? What type of movement activities do you enjoy? Tell me about your nutritional habits. How much water do you drink each day? Do you fast on a regular basis? How is your energy? Are your low resting heart rate and blood pressure numbers typical for you? Once the doctor came in, he confirmed that the numbers showed something different than my actual condition and that I was out of norm. However, they had to follow a certain protocol to review the numbers based on my age. I truly believe these healthcare professionals meant well, but following a structured protocol without looking at the patient or asking better questions is not the answer. The future of healthcare. Okay, enough of the doom and gloom. I wanted to tee up some of the challenges we are all facing to make the point that now is the time for everyone to get in the game of health. Changing our healthcare system for the health of our people can and must be done. There are many incredible minds working hard to improve our current healthcare system. Here are a few strategies that must take place for a healthier world. Price transparency and healthcare costs. Lack of price transparency is a problem in our current healthcare system. Did you know that the price of a knee replacement ranges between $25,000 to $60,000? Or the price of a heart bypass surgery ranges between $70,000 to $350,000. Why is there such a large disparity in pricing for the same procedures? We have a pretty good handle on what most goods and services we use on a daily basis cost. We would never buy a car, go to the movies, get a haircut, buy a pair of shoes, have a massage, or even buying a house without a good idea of how much it's going to cost. We need to have the same type of price transparency when it comes to our healthcare services. Imagine if there was a menu of procedures, services, and medications with a price tag next to each, like a menu at your favorite restaurant. Colonoscopy, $1,500. Knee replacement, $25,000. Heart bypass, $80,000. Childbirth, $10,000. Cholesterol medication, $200 a month. Dialysis treatment, $150 per visit. This price transparency is currently being done by many surgical centers around the United States. We need to bring price transparency across all healthcare systems. Increase competition for healthcare services. Having competition in any market keeps everyone on top of their game. If there's only one grocery store in town, they could increase prices and in most cases not lose a single customer. Why would you pay $30,000 more for the same surgical procedures or $200 more per month for the same medication? What if we had the option to shop around for the best quality care at a fair market price? Studies have shown that hospital pricing in monopoly markets are 15% higher than those with multiple hospitals in the same region. We need to have competition in healthcare to maintain high quality at a fair price. New technology. The amount of new and exciting technology coming to the healthcare market has exploded and will continue to expand at a rapid pace. This new technology will drive industry-wide transformation with new diagnostic procedures, healthcare data, analytics, artificial intelligence, telemedicine, and security solutions, just to name a few. There are many medical advances currently taking place to improve healthcare outcomes. There has also been an explosion of personalized fitness tracking wearables. These devices can help measure almost everything we do during the day and night, including the amount of stress we have, how much sleep we get, how many breaths we take during the day and night, and how our heart is beating and the variations it goes through every 24 hours. They also track how active we are by tracking steps and even how much we sit in a typical day. Personal tracking devices. Many people ask me, what do I think about all these personal tracking devices? I think they can be extremely beneficial in creating a sense of awareness of our own health and can also be beneficial when used by many healthcare professionals to learn more about their patients. Imagine a future doctor's appointment where you breathe or speak in an artificial intelligence box. The information is then transcribed for your health professional to make the necessary recommendations. Let's return to the art of healthcare. Our healthcare system's focus has been and continues to be placed on treating the symptom rather than the source of the problem. Matching the procedure or pill to the illness is not the answer. The future of healthcare must move in the direction of prevention, on thriving, not just surviving, on playing offense versus defense. This is our future. Our greatest asset, essentials. Big picture. Health quality around the world continues to decline. Healthcare costs in the United States gobble up 17.5% of our GDP to a tune of $3.5 trillion each year. The United States spends more on healthcare than any other country in the world. Too much time and energy and too many resources are spent on trying to find cures rather than on prevention. The future of our healthcare must move in the direction of prevention. We are on the verge of a wellness revolution when it comes to our health. Ask yourself, why is the quality of health in the United States declining when we have the latest technology in medicine? Did you know that chronic illnesses account for 85% of all money spent on healthcare in the United States? Did you know that the average 65-year-old in the United States takes over 5 prescription medications? And what would result if everyone looked at our healthcare system from a new perspective? Small steps. Take steps to improve your health. This will contribute to the improvement of our entire healthcare system. Ask better questions when working with your healthcare professionals. And last, change your mindset and take back control of your health.